We are the Marquette Group presenting an animal-assisted therapy. Animals play a significant role in the lives of humans that goes way beyond survival needs. Animals used for therapy purposes tend to have a natural tendency to bond with people and look for affection from those around them. The human and animal bond provides physical, psychological, and physiological benefits to both adults and children. The focus of AAT is to improve the human physical, mental, emotional, and social functioning. A number of animals can be involved in this process, including dogs, cats, horses, birds, and farm animals. There are several methods AAT incorporates into different programs depending on the needs of the individual. One particular method is working with third graders. In a reading program, this program was designed to help third graders increase their reading rate, accuracy, and comprehension. The study found that the third graders had less anxiety when reading to dogs, thereby increasing their rate and accuracy. Depending on the program, extensive training is mandatory. The Reading Education Assistant Dog Program, otherwise known as READ, is an example. It requires 8 hours of basic workshop, 4 hours of active orientation, and 3 hours of READ training and on-the-job experience. These trainings are designed so you can be an AAT. The Delta Society is the leading and one of the largest North America organizations in AAT. This society is a nonprofit organization emphasizing the importance of human-animal bond. There are an estimated 2,000 programs just in the U.S. The second leading AAT organization is Therapy Dogs International, focusing on canine activities. For history, the first recorded document for AAT was York Retreat in England, founded by the Quakers for the treatment of mental illness using animals as an adjunct to therapy. Sigmund Freud believed dogs had a special sense. His dog, Jofi, attended all Freud's therapy sessions, and the dogs had a tendency to be closer to the patient and show less anxiety, and if they're away from the patient shows more anxiety. Florence Nightingale was another person who used pets as a companion for her patients. In 1867, Germany, epileptic patients were allowed to interact and take care of the farm animals. In 1919, Washington, D.C., Franklin Lane, a Secretary of State, suggested psychiatric patients use AAT. In the 40s, farm animals were part of the AAT program in the United States. And then in the 60s, Boris Levinson could reach children with mental disorders by having his dog, Jingles, present during his therapy sessions. There have been several other cases and programs developed through the years, and the AAT programs have been successful through most circumstances, including working with police, hospitals, schools, trauma victims, and children diagnosed with autism, attachment disorder, and ADHD. AAT with children are that although the therapy dogs are interactive, children seem to perceive them as non-judgmental participants who are outside of the complications and expectations of human relationships. We now move to evidence-based practice.
Evidence of AAT as an evidence-based practice, or EBP, is somewhat weak. There are a limited number of randomized controlled trials, especially when you're comparing them to other forms of EBPs, such as dialectical behavior therapy, cognitive behavior therapy, and so on and so forth. Many AAT experiments do have small sample sizes, but nevertheless, when one considers all of the data, there is evidence of reduced anxiety and depression among those who are exposed to therapy animals, as well as improvements in sociability, affection, empathy, and activity levels across a variety of demographics. Empirical evidence for the application of AAT to contexts and systems such as people with substance use disorders. There is evidence that it creates a trusting environment where clients feel more comfortable to engage in self-disclosure and experience trust and empathy. Patients with dementia, they've been able to demonstrate that there are long-lasting changes in patients residing in nursing homes and an increase in activity levels, especially among women. Patients were more relaxed and less irritable, and the overall comparing men and women in these nursing homes, there seems to be a greater effect size in women compared to men. There's an improved psychosocial outcome in long-term psychiatric patients and people with intellectual disabilities. And there's a greater effect size in these populations because these groups are at greater risk for social isolation, functional deterioration, and low social impact, low social support. There's an improved well-being among prisoners. Incarcerated women who were allowed to train dogs to be used as therapy animals, they've been able to demonstrate that there's an improved sense of self-esteem, self-worth. Patients reduced disciplinary records and reduced tension. AAT Animals gives prisoners an opportunity to interact with a living being with no interest in their past actions or mistakes. They've been able to demonstrate that use of animals in therapy settings with children who have been sexually abused. They've demonstrated a reduction in trauma symptoms, including anxiety, depression, anger, PTSD, dissociation, and sexual acting out. Exposure to dogs prior to group therapy helped children feel more comfortable opening up and sharing their experiences and feelings in group treatment settings. Play therapy helped help children share their experiences with therapists because the children can act out their experiences through play, and it helps kind of build some rapport between the client and the therapist. The overall quality of the evidence is pretty good, all things considered. Researchers are striving to conduct more randomized controlled studies. They want the research to hold up like other forms of evidence-based practices. Meta-analysis studies point out weak areas such as small sample sizes, limited number of control trials, inter-rater bias, and the fact that there are just a lot of case studies. There's been over 50 years of research on top of the history that Sue had explained a little while ago. The research helps to support the correlation between AAT and the improvements of symptoms. Smaller sample sizes and case studies are used as a basis for larger random controlled trials. Studies examine the effects of the animals on the patients. Some feel that the exposure to larger animals like horses may be more therapeutic towards traumatized people and those with severe mental illnesses because they are predatory animals like dogs are, so they might feel a little more at ease. There are some studies that examine the salivary cortisol levels in dogs and found that dogs need time off just like people do. Salivary cortisol levels were better when they were given breaks and some time off. And they did not perform as well when exposed to chronic stressors and when they were overworked. So what does this mean to practitioners? A wide variety of evidence collected over 50 years indicates that therapy animals can be a useful tool in the therapeutic process. Clinicians can rationalize the use of animals in a wide variety of treatment settings. Animals typically used for goal-directed approaches to treatment, and for example, dogs can be used for several sessions as an icebreaker and to build trust between the therapist and the client, thereby strengthening the therapeutic alliance. Volunteer groups such as shelters, farms, horse ranches, and among others can be used to help keep the costs down if you do choose to implement animals in a treatment setting. However, these animals are not typically trained and can be more unpredictable, so caution must be exercised. There are some volunteer groups who have trained therapy dogs, and they go to a variety of different settings, such as nursing homes, so that the patients can interact with these dogs. Now, the only problem with that are confidentiality laws, so these volunteers are usually required to sign and adhere to confidentiality laws and contracts in order to protect the client's identities. And we are moving on to the next one.
In terms of the application of animal-assisted therapy, AAT has been found to be suitable for all ages. It benefits both physical and mental health. In fact, it's been shown to decrease blood pressure and lower cortisol levels. AAT benefits clients with no or limited verbal ability. It is also beneficial for those who are withdrawn or have difficulty connecting socially. And it has been successful with clients who don't respond well to talk therapy. Continuing with applications of AAT, It has been found to be effective with individuals who have PTSD, borderline personality disorder, anxiety, behavior disorders, ADHD, loneliness and depression, and those with autism spectrum disorders. The use of AAT in therapeutic sessions can increase safety, improve self-esteem, increase pro-social behaviors, and diminish problem behaviors. Lastly, in terms of the application of AAT, it may also help facilitate emotional processing through the use of a companion animal. By providing a more comfortable and safe environment, clients can remember past traumas and explore these memories in the presence of an animal such as a dog or cat.
In the critical review, we'll start out by reviewing the strengths of animal-assisted therapy. It fosters a normalizing and trust-building element to the therapeutic setting. Really, the interest from social work practitioners to use animals was really to help start facilitating that trust-building relationship and that therapeutic connection that has really grown the use of AAT. Also, AAT is goal-directed, so practitioners work with the animals in the therapeutic setting to really help engage clients in different types of evidence-based practices, as you heard earlier in this presentation. So AAT, by contrast, is goal-directed. So for example, a clinician social worker may use AAT as a part of the cognitive behavioral intervention for anxiety or social phobia, while another may use AAT as a part of a narrative therapy approach, whereby stories about the animal's life and resilience provide a platform to eliciting stories about the child's life, if you're talking about a child therapy intervention. Animals also, through the reciprocal transactions, animals qualitatively contribute to people's lives. So they really do make a contribution to the lives of many people, influencing their development and adaptation throughout those reciprocal relationships. And as you've heard several times, I'll reiterate here that animals and children really do have this natural bond. I just want to put the disclaimer on that's of course specific to the Western culture, at least. Animals and children are considered to have this natural bond. And we'll move on to the next slide, Rich.
For limitations, for clients, it's probably not best to, at least not without being very careful, to use animal-assisted therapy with clients who have a history of animal cruelty. You'd have to pay extra special attention to what's happening there with the client. And of course, clients who have a fear of animals would also not be the best choice. And clients who do not have an interest in animals, one example I can think of there is somebody who lives on a farm, and so animals is, having animals around is no big deal, no special thing. For the clinician, well, animal-assisted therapy obviously has a benefit. Only about 25% use it in practice. There are some trainings for animal-assisted therapy, but they're not. It hasn't been standardized yet. Potential for animal-assisted therapy is could be used a lot more. It's been untapped.
Going into the complications, much of this, as Richard just spoke about, the limitations applies to this first one, where the clinical responsibility of care and ensuring the safety and humane treatment of the animal being used, that responsibility is added responsibility to the clinician. So social workers really need to be conducting more comprehensive assessments and develop individual plans for therapy accordingly. This, of course, is already done, but just it's going to have to be brought into considering that animal engagement role. And also looking specifically at the animal, there is animal burnout from long-term exposure to stress, much like people in trauma stewardship experience have a stronger likelihood of experiencing burnout. So do the animals that are being used and engaged with the treatment over the course of their careers. Most will have developed a range of self-care strategies to mitigate these effects. But long-term exposure to stress can also have a very detrimental effect on the animal, also known as the co-worker, in much the same way as it can the social worker. And when you're looking at certain animal-assisted therapies that require a lot of resources, one more popularly known one is the equine-assisted therapy. It can become very complicated and costly. So when you're looking at facilities, the horses that need to be trained and certified, and the handlers, the likelihood that this type of therapy can be more generalized and utilized more broadly is possibly not plausible. Next. Rich, we can't hear you.
Right, okay. So animal-assisted therapy, we're getting closer to summarizing here. It can be used for emotional support, to foster attachment and companionship during therapy. And also that's used in people who live in nursing homes quite often. Animal-assisted therapy is used there. It's used for developmental issues or life stressors to help people reduce their stress. And in especially education programs for children, especially to help them increase their empathy with people.
So, the critical review and how it's in line with social work values and ethics, it is very much in sync with the ecological systems theory focus of social work, meaning that it's focused on the interdependence of life forms and the environment that they inhabit. And this has provided a convenient metaphor for social work practice. The evidence-based practices that it pairs up with nicely as has been discussed. And the primary ethics consideration, again, is ensuring the safety of the animal, clients, and the therapist.
We're going to show a general demonstration of how animals assist in therapy. The video we have highlights Harv, the court therapy dog who supports people on the stand.
Something we wanted to highlight in terms of animal-assisted therapy and practice is this model can be incorporated in a plethora of settings, ranging from individual, group, institutional, judicial, private, public, etc. And not only does animal therapy cross into different settings and help with different clientele areas, it utilizes all different types of animals as well. Some of the most popular being canine, equine, and dolphin. All right, here is our demonstration.
Okay, so this is Harv. Harv, come. Harv, sit. Harv, do you have dogs? Yeah. Oh, that's right. Harv, okay. Harv, sit. Okay. When he comes in the morning, he's got a snack. I gotta get it out of my system. We put on this, one of his scarves that has the Canine Advocacy Program on it and his special collar. Then he knows he's going to work. And then whenever we're usually meeting with somebody, a client or a victim, Harv, come here. Sit. We are trained to typically have him on the leash, but he's so docile that he doesn't do too much. So for instance, we give him his little dog. So say you were a victim here and you were having some high anxiety about coming to court. So we would just have your arms set. You say hi. And then I would give you maybe some treats you could give him. He will give you the paw or but he is here to just alleviate any fears and anxiety that somebody might be having. And we do take him into the courtroom. I've had one case where he was on the stand with somebody. He just kind of laid down. He laid down. And was just there for petting if he needed. Let's see. Just meetings here in our office. We'll take him in the conference room and he'll just sit there and he's meant to be a big help. Yesterday we had a big case where we had a CS.
This is our brochure. We have references here. The end.